Howdy y'all, in this video today I'm going to talk about the death of Chadwick Boseman, colon cancer, what's going on with colon cancer developing in younger individuals. So you may have heard that Chadwick Boseman passed away from colon cancer at the age of 43 years old. He was diagnosed 4 years earlier at the age of around 39 years old. Now, I don't know Chadwick Boseman. I am not part of his case. I don't know exactly what happened, but he obviously got diagnosed with an early stage colon cancer. So I deal with colon cancer, unfortunately, every single day. I deal with colon polyps, which are the precancerous lesions that lead to colon cancer. So I deal with having to deal with patients who unfortunately develop this terrible disease or this terrible cancer. One of the hardest things I can tell a patient is that they have a cancer that was preventable if they would have gotten their colonoscopy done sooner. And so currently the recommendation is to start colon cancer screening at the age of 45, but no later than 50 years old. There's a lot of debate on when we should start colon cancer screening. However, I will tell you things change if you have a family history of colon cancer. So if you have somebody who has a first-degree relative who has colon cancer, or yourself if you have a first-degree relative who has colon cancer, that means you need to get your colonoscopy soon. But also importantly, if you have symptoms, that is something that you should not ignore. Symptoms like bleeding, changing your bowel habits, weight loss, abdominal pain, having pencil-thin stools. These are things that are not normal, and these are things that you should not just ignore. The most common symptom that people have when they have early onset colon cancer or colon cancer at a young age is just rectal bleeding, the occasional bleeding, people assuming it's a hemorrhoid. This is why that if you have bleeding, I stress the fact that you need to get screened. You need to have someone take a look. You need to have someone evaluate you to see exactly what is going on. Because unfortunately, a lot of patients just ignore that. They just assume that everything's doing okay and that everything is not a big deal until it actually does become a big deal. So why are we seeing younger and younger patients who are developing colon cancer? We don't quite know the answer to that. We don't know if this is a brand new cancer. We don't know if there is a role with diet, genetics, environment. We just don't know the answer to that. But we are seeing younger and younger people who are getting screened. What can you do today to make sure that you're safe? Number one, once again, if you have a family history of colon cancer, get screened. Number two, if you're having symptoms, get screened. Number three, there are things that you can do with your diet to help minimize the risk for colon cancer. Stop smoking, stop drinking alcohol, minimize or eliminate red meat, increase the amount of fiber by either increasing your vegetables or increasing your fruit. But the most important thing that you can do, better than any diet, better than anything out there, is to get screened. Whether it's with a colonoscopy that I perform or whether it's some sort of screening test, get screened. That is going to be the number one thing that you can do to help prevent and stop colon cancer. Guys, and thank you for watching. It's been a kind of a hard day for me. I was a big fan of Chadwick Boseman. I loved his movies. I love Black Panther. And to see him pass away from colon cancer and him fighting this for the past 4 years without anybody knowing about it, he fought a brave battle, and it's a battle that I hope none of you ever have to fight, because it is difficult, it is hard, and don't die of embarrassment. Get your colonoscopy, get screened, let us save you. Thanks, have a good night, guys.